Hi, Tendercare families and anyone watching. My name is Darcy Tower, and I am the Director of Advocacy and Community Relations at Tendercare, and I am here with one of our Tendercare owners. I will let her introduce her fabulous self.
Hi, everybody. My name is Kelly Staley. I am, like she said, one of the owners, but I'm also the Chief Clinical Officer here at Tendercare.
She's a nurse.
I am. I am.
We thought we would hop on. We've seen a lot of updates floating around and questions about the health and wellness waiver updates, specifically as it's related to this new extraordinary care definition. And so that's what I thought it would be good to have a nurse join our call, and then I'm a social worker, so you've got best of both worlds. And so we just want to talk a little bit about, we've heard families are really excited about the possibility of having attendant care in some form back if their child meets the extraordinary care definition. And so we want to talk about that definition, really highlighting that the extraordinary needs are skilled nursing needs, vent, trach care,
Right.
TPN,
Yeah.
and there's some language that I think is making families a little bit nervous, where it says in any comparable nursing services, which I know opens up the question of, well, what about a G-tube?
Right.
Yeah.
Well, and I think that while some of the information is still a bit vague as far as what will qualify as being extraordinary and what does not, when you're talking about things like a ventilator, like a trach, or a TPN, which requires a central line, those things inherently are a higher skill level, generally speaking, than having a feeding tube. So while we don't know for sure how those situations will be handled, we do think that it is going to lend itself more to those higher tech cases, not so much to the G-tube only. We don't know for sure. But
we don't know.
Yeah.
But I would say, if families have questions about, or want to try to see if their child meets that extraordinary care definition, first reach out to your waiver case manager, and they can help you go through that process. Tendercare is here if you have any questions about, how do you explain the care that you are providing. One recommendation we have is to create a schedule, hour by hour schedule of what types of hands-on care you are providing. The other part of this definition that Kelly and I have talked about that's really important is that the care that you are providing as the parent is above and beyond what you would provide to a child of the same age who does not live with a disability. And so one of the examples that we have talked about,
right,
is, if you have a 5-month-old child, right? Every 5-month-old child, you're going to change that child's diaper.
right.
And so that is not,
That wouldn't
that
wouldn't be considered an extraordinary care need for a 5-month-old. Now, if that 5-month-old has different types of ostomies or different types of catheters or what have you that complicate that diaper change, that's where that extraordinary piece comes into play. While it's maybe more work to change the diaper of a child with a G-tube, it's still a normal part of the care of a 5-month.
I think that's a really good way of looking at it.
Right.
Yeah, and so we want you to know that we are here, and part of looking at extraordinary care is very similar to what Tendercare does when we are looking at, if you are a person who receives PA for home health aid or nursing. We have a clinical team who is always reviewing clinical needs of individuals, and so we're very used to pulling doctors' notes and
Right.
all of that good clinical information, and we can help your waiver case manager with any information that they need.
our clinical team is really all about digging into those details, even though I know digging into the details sometimes can be a pain a bit. We kind of have to get all up in people's business, but in order to make sure that folks qualify for their PA hours, it's really a necessary part of it. And I have a feeling that more of those details are also going to be required to qualify for extraordinary care.
Agreed. We do have good news about structured family care, sort of switching topics, is that it's only one visit per quarter. We're only going to bug you one time per quarter for structured family care.
So it's actually going to be a little bit more than one time a quarter. It'll just be every 60 days.
It's those details.
Yes.
That's why Kelly's good at those details.
It's just no additional visits. So you'll still be visited by the case manager every 60 days or so for those recertification visits. There just won't be any additional visits. So every 60-day visit cadence will continue, but there won't need to be any additional visits because that inherently will meet the once a quarter. So.
Awesome. Yeah. And then I think the only other big pressing issue for families seem to be questions around self-directed care.
Right.
Yeah, which is new to many families. It's it's lived on the health and wellness waiver for a really long time, but now it's opened up to all the waivers. So if you're on the CIH or the FSW, you now have access to self-direct your care. And I know, being an agency, Tendercare just hasn't, we don't delve into that, but we do want families to understand that a big part of self-directing is, one, that the we call the patient or the individual receiving services is really the one who is directing their care. And so when your waiver case manager, if you're interested in self-direction, one of the, things that they look at is the person's ability to hire their caregiver, find their caregiver,
manage their time
sheets.
Yes. All of those types of things. It kind of, it cuts the agency out of it, but it also kind of puts more work on the patient as far as just kind of from an administrative burden for them. From what I understand, correct me if I'm wrong, is that the individual who's self-directing their care, they will receive a budget for the year. And then if they kind of cut 10% off the top of that budget for FSSA to run the people's background checks and to kind of do their payroll, all of that type of stuff. But it is up to the patient themselves to submit their caregiver's timesheets to FSSA. All of those things that patients of Tendercare don't currently have to worry about because we have staff here that handle all of that kind of administrative burden. So while it might sound good, I think it's important for families to kind of really weigh those options and see what makes the most sense for them. Obviously, we would prefer that you stay with us, but if it is a better option for you, we'd be happy to talk to you about that as well. But it does create a bit more administrative burden for the families. So
it does, and one of the I know a lot of parents of minors who are on the waiver. FSSA has said not able to provide self-directed care.
Right.
So we do know that they put some limitations around that.
Right.
Yeah.
Right. Makes sense that a minor wouldn't be able to self-direct their care.
They cannot self-direct, right.
I wouldn't trust my 17-year-old to self-direct her care. So yeah, makes total sense to me.
Sometimes I wouldn't trust myself to self-direct my care. Absolutely. But yeah, I think, if there are questions about self-direction, it gets very nuanced and it's unique per person. And so if there are questions, please reach out to us. I will post, or actually our lovely marketing team will post this for me. But FSSA created a very good toolkit for self-direction with, the questions to consider if you want to do self-direction, just thinking through those options and how to go about that. And so we will include that so that families have that resource. But again, we are here to answer questions.
And to be clear, if you're going to ask questions about self-direction,
Yeah.
ask Darcy. You have clinical stuff or PA
Yes.
related anything. You
All
can ask
clinical
me about that stuff.
should go to Kelly.
That's why we make a good team.
Yeah, exactly. But those are our waiver updates. We just wanted to hop on and let you know we're tracking them, we're watching them. And if you have any concerns, any questions, please reach out. We are here to help.